Well, my friends, this is a case of hydrocephalus. This patient is brought to me by Dr. Ganesh, practicing at Tamluk of Midnapur. So, hydrocephalus. No vision. Vision is already lost. Now, all of you know that hydrocephalus means excessive accumulations of cerebrospinal fluid within the ventricles of the brain, which leads to dilatation of the ventricles, followed by increased intracranial pressure, a result of which distension of the brain and enlargement of the circumference of the skull. It is generally found in children when ossification of the cranial bone is incomplete. The enlarged head of a hydrocephalic infant or child may be globular or rounded in outline, and the forehead bulges forward over the eyes. So, I have demonstrated many cases of hydrocephalus in homeopathy. In many cases, we may improve many childs. This may be congenital or acquired. The modern mode of treatment is surgical intervention. The cerebrospinal fluid is to drain out from the distended cerebral ventricles. Symptoms range from none to sudden death, depending on the speed at which and degree to which hydrocephalus develops. Enlargement of the head is the main sign, which grows bigger and bigger within short space of time. The skull veins become prominent, the fontanelles fail to close, the cranial sutures gap become opens. The cranial sutures gap and becomes open, the frontal bone bulges forward, and the eyes go downwards and forwards. All of you know that the cerebrospinal fluid is a colorless fluid, is formed in the choroid plexus of the lateral ventricles of the cerebral hemispheres, called right and left lateral ventricles. The lateral ventricles are separated by a narrow septum and lies one on each side of the median plane just below the corpus callosum. যারা ব্রেনের অ্যানাটমি মনে রাখতে পেরেছেন, যে সমস্ত হোমিওপ্যাথিক চিকিৎসকরা তারা পরিষ্কার বুঝতে পারত। The choroid plexuses are weight like The choroid plexuses are high vascular structures and are responsible for secretion of cerebrospinal fluid. From the lateral ventricles, cerebrospinal fluid passes into the third ventricle via foramen of Monro. From the third ventricles, the cerebrospinal fluid comes into the fourth ventricle through a narrow duct known as aqueduct of Silvas. And from the fourth ventricle, cerebrospinal fluid enters into the cisterna magna and cisterna lateralis through the foramen magnum and foramen lusaca. Through the foramen magendi and foramen lusaca, not magnum. Magnum is the foramen within the occipital bone. And the cerebrospinal fluid then enters into the subarachnoid space and drains into the superior sagittal sinus. And some amount goes below into the central canal of the spinal cord. The cerebrospinal fluid circulates constantly from the ventricles, and after traveling all the ventricles, passes into the blood through the tiny finger-like projections of the arachnoid matter called the arachnoid villi or arachnoid granulations, which project into the venous sinuses. The movement of cerebrospinal fluid from the subarachnoid space to venous sinuses depend on the difference of pressure on each side of the walls of the arachnoid villi, which acts as one-way valves. However, this child has operated. These are the papers. কোথায় অপারেশনটা হয়েছে? এইমস ভুবনেশ্বর. The child was apparently all right 2 days back when they developed developed abnormal body movements involving all 4 limbs. এখন কনভালশন হচ্ছে, তলকা হচ্ছে মাঝে মাঝে হয়. So however, after operation, the child developed convulsion. Now, by symptomatology, I have prescribed the medicine calcaria cup and nectum salvage in my hand for convulsions due to thinking the region operations after due to head injury. So hydrocephalus is improved by shunting, by rejecting cerebrospinal fluid, but new symptom developed convulsions and nectum salve may be the choice of medicine. The present symptomatology, considering the physical makeup, constipation and sweats, etc., I have prescribed calcaria carbonica 1 to 4 with the direction thrice in a day. Let's see the result, my friends. I shall share you.